Good morning, everyone. First of all, I would like to thank AIOS Scientific Committee who has given me an opportunity to speak in front of you all. Today, I am going to speak on benefits of good preloaded IOL delivery system, as already discussed by Dr. Anurag and Dr. Goel. This preloaded IOL injector system by Hoya and this preloaded IOL injector have many desirable features if you are comparing with the manual loaded system. First, it is very easy to prepare and it increases safety by reducing the risk of contamination and infection. And the chances of IOL damage is also very less. This preloaded system reduces the number of contacts what we are with surgical instruments during preparation, which helps to reduce the risk of bacterial contamination, and it doesn't require any reprocessing, and by this the risk of cross-contamination is less. By this preloaded IOL injector system, we are less reliant on the skill of a person who is loading the IOL, and the chances of IOL optic scratch is because of the forceps is very less if you are using preloaded IOL injector system. The best is it minimizes the time spent which we are preparing for the IOL delivery system, and it is creating fewer instruments to reprocess. And it has been assumed that a total of 33.7 minutes can be saved per surgery if you are switching from manual lens loading process to a preloaded system. Means if some surgeon is doing 15 surgery in 3 hours, the same surgeon can do 16 surgery in 3 hours if he is using preloaded IOL injector system. As discussed with by Dr. Goel, it's more predictable. This beauty of this Hoya preloaded IOL injector system is 100% you are predictable. There is no surprise in the lens, and the consistency is excellent. Means every time we are 100% assured that the lens will come in the same consistency, and each and every surgeon wants a smooth and controlled IOL delivery and unfolding with the haptic always in the same configuration. And this a good preloaded system tucks and delivers haptics in the same way every time. No surprise, excellent control. Everything is under your control. Not all preloaded injectors show the same consistency and predictability at the time of delivery. And one of the study have shown that 47 of 85 ACRISAT system needed additional IOL manipulation as a result of presentation of leading haptic, and other problems which we are getting from other preloaded injectors are trailing haptic optic adhesion, and IOL plunger override. One more study have shown that 10% of the Technics iTech plunger tip this adhered to the plunger tip immediately after the IOL has exited the cartridge. And 10% of the UltraSat showed the trapped trailing haptic when we are using 2.2 mm incision, and intra-wound lens manipulation is very common in all of the other preloaded. 30% of cases with iTech, 20% with the UltraSat when we are using incision size of 2.4 mm, and 10% of the cases with UltraSat if you are using 2.2 mm incision. Several studies have found that single-use preloaded IOL injector system have been found to reduce the risk of contamination, and the need for proper sterilization and handling of equipment has already been demonstrated by several endophthalmitis outbreak due to contaminated material. And this manual loading and insertion leads to exposure of the lens to the surgical environment, and that lead to the introduction of bacteria and finally to the endophthalmitis. A fully preloaded IOL requires fewer touch points, and in case of non-preloaded IOL, touch points are more, and that may lead to contamination and lens damage. These are the two pictures in which we are showing. In the left side is non-preloaded IOL and right side is fully preloaded. So much of exposure is there in the left side, in case of conventional injector application, and here exposure is very less. We are not at all touching the lens in case of VBNex multi-set Hoya IOL. These are the Hoya preloaded IOL portfolios. They are coming with the IOL brands like iSet initially. Now they have come up with the Nanex multi-set and recently VBNex multi-set. And these key features of this Hoya preloaded are rotational stability. It's very glistening free. They are having proprietary aspheric design, 4-in-1 multi-set injector already discussed, and they are having active oxygen processing treatment, and the best is the smallest nozzle preloaded hydrophobic IOL at present in the world. This innovative design of Nanex, which allows us to do the surgery in less than 2.2 mm incision without any compromise, and it minimizes the wound stage and allows us for minimal invasive surgery through the smallest nozzle size available for an open loop preloaded hydrophobic IOL system. And already I have discussed regarding the predictably lens release, which is the Hoya unique patented preloaded IOL delivery mechanism, through which the predictably lens release is excellent, consistency is there, smoothness is there, and they are having 4-in-1 IOL preloaded IOL system, and it provides the choice push or screw injection. This Nanex 4-in-1 preloaded IOL system provides multiple choice at your fingertip, a single-handed push in the and two-handed screw within one device. Nobody is having this kind of device now at present. Though in the same lens we can get the single-handed push, or we can screw it. This insert shield is uniquely designed by this Hoya company for the precise depth management of the injector tip insertion. The injector tip is very big. If you want to go directly, if somebody want to go directly an implant in capsular bag, we can go directly, and if somebody want from the incision wound, so just we have to advance the insert shield, the tip, the injector tip, the size will be reduced, and you can directly deliver it through the incision wound tunnel. Multi-set provides peace of mind. This peace of mind is very important because every time after doing excellent surgery, everybody, if you are using manual preloaded IOL, IOL delivery system, so every time we are worried whether the lens will come in the consistency or no, that you are not sure. Means the surprise is always there. But when you are using Nanex, the peace of my 100% we are sure. So after finishing the after doing cataract surgery, at the time of implantation, 100% we are sure if I am using the Nanex or any Hoya preloaded. But in other cases, we are not sure. So always the surprise is there, and this Nanex is highly consistent, predictability, and smooth IOL delivery system. And out of 630 attempts, no leading or trailing haptic tucking failure has seen. It has 100% result, and broken injector tip already discussed by Dr. Goel. So it has not been seen in 630 attempts. I am using this Hoya preloaded for last 12 or 13 years, and they have retained 630, more than 7,000 I have implanted, but I have not seen in any cases of any leading or trailing haptic tucking failure and like that. This one fits all, 4-in-1 multi-set preloaded injector. Everything's there in one injector. The key point is that after coming this injection system, there is a paradigm shift in the IOL injection system. Multi-set 4-in-1 fully preloaded injector system by Hoya provides us multiple choice at your fingertip, a single-handed push or two-handed screw injection within one device. It is your choice. These are the pictures of 2013, and I was fortunate to get an opportunity to implant for the first time 251 toric IOL, preloaded 251 toric IOL for the first time in Southeast Asia. Thank you.